Hey, it's Chris Beyer with CB Squared. Today we are doing a CB Squared In Focus conversation with Tom Seltz. Tom is part of our team helping our clients navigate the world of compliance. Tom, welcome. Glad you could join us.
Glad to be here.
So Tom, I know your background has brought you all across the insurance industry. Today you focus again with our clients on helping them navigate healthcare and welfare compliance on many different topics. But what have you done in the past that's kind of brought you to this point where you understand the ins and outs of what employer groups are dealing with every day?
Sure. Well, I have several employers in my background. I started right out of college, and I graduated in 1994, and I worked in Minnesota as a legislative specialist for one of the, actually the largest insurance company in the country,
Yes.
Health insurance company. You may have heard of them.
We might have, yes.
Yeah, they're still the largest. So I worked there first. Then I worked for about 7.5 years for a disability insurance company, which gave me a really great perspective on ancillary lines, especially disability coverage, because I worked and trained in the claims office. But I got to really know a lot of the rules around ERISA and a lot of the stuff that applies to all types of health and welfare plans. I think it gave me a different perspective than I would have gotten if I was just at the healthcare company. Then I moved to Washington, D.C. and spent a better part of a decade as a broker. I was a producer doing what you do, selling and servicing group employee benefits. That gave me a much better experience and understanding of what employers need, what they understand and don't understand, and what the pain points were. And sometimes knowing where the bodies are probably buried, if you know what I mean.
And to have that experience in Washington, D.C., I mean, the home of the Affordable Care Act,
and I was there when it was passed. So I was very active with I'm a part of my professional association. I would do Capitol Hill visits, and I visited quite a few legislatures trying to affect, and I think did impact in a few ways, a few small ways, how the Affordable Care Act turned out and what was in it. So yeah, I studied the House version, the Senate version, and then Ted Kennedy died, all that, and then
knew it inside and out.
Yeah, so I was there through before it and through the beginning. So I think when it was passed, I think because of those, I don't want to call them lobbying, but because of those government relations sort of experiences, I feel like I had a better handle on that law and what was required, the day it was passed, a better handle on it than most people did, honestly, that weren't directly involved, because I was there for it.
So flash forward, now you're with us with AssuredPartners and working with our clients. The area of that, having that background, I think, like you said, it from the carrier side, from the broker consultant side, from the employer side, now as you work with our new clients, especially as they come on board and they start to work with us, and we're developing out that blueprint and helping them identify ways that we can make their benefit plan perform better. What does compliance onboarding look like? I know, Tom, we work with a lot of those 100 plus employee groups, and you spend some time with them. Compliance is a scary word. What do you do when you onboard a new client with compliance, and what does that look like?
Sure. So I have an agenda that I follow. Each time I meet with a new client, it's actually a pretty different experience.
Yeah.
I find there are certainly patterns, but there's always something that's important or causing problems for each client that I couldn't have anticipated. That only sitting there and just going through my laundry list of items, do I catch things? And I always do catch things. I don't care how experienced or inexperienced or seasoned or how large or small the client is. There's always things that either no one's ever told them before, or they didn't realize, or they're doing almost right, but not quite. So it really depends. So I also tailor it based on whether the group is subject to ERISA or not. So most of our clients are private sector employers, so they're subject to ERISA. But we have municipalities and county hospitals and other, that the rules are similar but a little bit different under the Public Health Services Act. And then, of course, church plans are a separate set, have different rules that apply or don't apply. So if they're an ERISA plan, I actually spend quite a bit of time, a surprising amount of time, I think, on ERISA compliance. I think true. that COBRA gets an Affordable Care Act, and there's certain rules and regulations that get a lot of attention.
Right.
ERISA is one that's just ignored by a lot of brokers, honestly. So when we onboard someone, one of the first things I do is explain what an ERISA health and welfare plan is, how that's different from what
Sometimes that's brand new, right? But
it's regularly brand new. Yeah, yes. I've met with clients with 700 employees, and they didn't know that there was a difference between a plan and a policy, and that they've got both. They thought they had one and not the other. So I think talking about ERISA and the fiduciary duties and kind of the relationship between the ERISA plan and the insurance policy and how the how you the checkbook and the lawsuit, the checkbook comes out and the lawsuits happen when your ERISA plan promises something that your insurance policy doesn't cover.
Yes.
And so when we talk about it in those terms, I find that all the little things start making a lot more sense. They start understanding things. And when they read things about compliance issues, they understand it at a whole new level than they wouldn't have if I hadn't taken that time to just explain those relationships and what's really going on and what the stakes are.
Well, and Tom, I think when we walk out of those meetings too, like you said, it doesn't matter the employer, we're going to have a checklist of something to help fix. And what I love is that you don't just throw a whole bunch of generic information to that client, and you definitely don't tell them to go Google those answers. That's a no-no.
I asked them not to Google. Actually,
do not Google. That's bad. Everything
there's some. Yeah.
No, I was just going to say there's sometimes when we'll walk out of there with a list of 5 things or 25 things, and you methodically work through those and tailor each of those for that client. And it's something that is unique and custom for each of them, although there's some commonality between employers. But
for sure,
you may work on things for the next coming 3 years to make sure that they get up to what they need completed. So is that a one-time process when you go through onboarding, or how does that client then engage with you after they've become a new client with us?
Right. So I'm glad you mentioned the Google thing. I think if you gave me a couple hours, I could probably go fetch you 20 or 50 people who can just spew true facts at you all day, and they would be correct. So I finding the technically correct answer, I don't think is super unusual. I mean, you'd be a pretty bad helper, pretty bad consultant if you were giving out incorrect answers. But I think the problem is, and what I try to focus on, what my goal is that enlightenment, that interpretation, is that translation is like, okay, this is the rule. Okay,
we know it.
What's your reaction to this? What is your process or procedure going to be? Because I find if an employer has a good way a good internal process or procedure on how they do something, if I make sure it's compliant and they make sure it's sustainable and something that makes sense to them, they can actually forget about what the technical regulations say.
Right.
You just have to worry about following their process or procedure that I helped design, but we always revisit it. So the main point of the onboarding, and I try to stress this when we talk to new clients, is that this onboarding meeting isn't my service, and then it's over. This is the beginning. That just starts the relationship.
Yeah. And very much like our blueprint process, when we walk through, we want to have that discovery meeting to learn exactly what is working, what might be, on fire, and what we can do to correct it. And then we lay out a timeline of how we fix it.
Yep.
I think, Tom, as Chris and I, we know enough about compliance to be dangerous. We certainly are aware of the facts, but we do look to you to help the interpretation happen. And I think that's where our clients are feeling the confidence that they're not intentionally making mistakes. They're not unintentionally making mistakes. Right. And they know they've got a resource that can help. But Tom, we appreciate all you're doing for our clients. It's certainly making an impact for us at CB Squared as we're out working with new employers with new challenges that consistently come through. I appreciate you spending some time just talking through CB Squared in Focus this morning.
You got it. And remember, my desk looks this way so that yours and our clients doesn't have to. So
well said, Tom. We appreciate it. Thanks so much.
Nice to talk to you. Take care. Bye-bye.